Peripheral neuropathy, is that affecting you? Well, it affects 20 million people in the world. And although most people with peripheral neuropathy is coming from diabetes, chemotherapy, alcoholism, there's a group of patients, maybe it's you, who have peripheral neuropathy, but the problem isn't really being addressed because these are autoimmune peripheral neuropathy. Some of the top autoimmune diseases that causes peripheral neuropathy is going to be rheumatoid arthritis, Sjogren's, Raynaud's disease, and also lupus. And these are some of the top 4 problems that can cause problems with peripheral neuropathy. But most people don't really have a good grasp on what even peripheral neuropathy is. See, most neurologists and medical doctors or primary care is going to say, well, neuropathy has to do with nerves. Yes, that may be correct. Neuropathy has to do with nerves. But where does it start? It starts off with whichever autoimmune diseases starts to attack the blood vessels and the shunts around the blood vessels between the brain, the capillaries, and possibly between the nerves and the capillaries itself. And what's happening is now your blood vessels are not there anymore because it's deteriorating. Imagine if my hand is the nerve and I have my other hand as blood vessels. Blood vessels will surround the nerve, okay? That's how your nerve actually stays alive. Once again, this is a nerve, this is blood vessels, and over time what happens is the blood vessels around the nerve starts to deteriorate, like a rotten tooth. It starts deteriorating away. Well, when the nerve becomes exposed, now what happens is it's not getting blood flow anymore. It's not getting oxygen anymore. And it's gonna shoot sensors and pain sensors, numbness, tingling, burning sensation back into your brain because it's all connected, right? And it's gonna tell you, hey, we have a problem at your nerve endings. Well, many of these diseases attack your vascular system. And what happens is, as it attacks your vascular system, well, now it leaves the nerve exposed. But what happens most of the time is these are being treated with medications, narcotics, pain medications, anti-seizure medications to try to numb out the pain. Well, you're not treating the cause of the problem because this nerve is still deteriorating away even though you're not feeling the pain. Most pain medications, what it does is that it tries to block the pain at a nerve level, okay, or at the brain level. And what happens with anti-seizure medications is trying to block it right at the brain level so it's not allowing sensory to go from your body towards your brain. Well, what happens when your brain starts shutting down a lot of sensors, right? Because you can't really differentiate between good sensors, bad sensors. It's going to shut down the sensors messages from your body to your brain completely. And now some of the problems and side effects that you're going to have is forgetfulness, fatigue, you're going to be tired, okay? Your reflexes are going to go down. And guess what happens? Your muscles are going to also decrease in the way it responds to certain things. That's why a lot of medications, when you read the labels, it says do not operate heavy machinery. I mean, driving, isn't driving part of a heavy machinery? Here's the problem. If you always try to cover up the symptoms is nerve pain. But the cause of the problem is actually the vascular problem. If you're not doing anything to increase the blood flow to help decrease pain, well, the pain is always going to be there and it always gets worse. And now what happens? You have to increase your medications. And when your medications don't work, you have to switch from one medication to another, or you start taking one medication and you have to switch to a heavier narcotic medication just to numb the pain out. What we've been able to do at our office in the last 4 years is to help people with peripheral neuropathy, whether it's pain coming from diabetic peripheral neuropathy, chemo peripheral neuropathy, autoimmune disease peripheral neuropathy. We've been able to help people with the pain caused by that by really treating the root cause. We're looking at the root cause of the problem. One way we are able to help with peripheral neuropathy is we've developed a home care protocol where patients are actually able to really start taking better care of you at home. You don't necessarily have to come to our office 3, 4, 5 times a week to have relief from peripheral neuropathy. When you come into our program, number one, the first thing we're going to do is we're going to dig for the root cause of the problem. Second, we're going to take you through a very thorough exam to figure out, well, how severe is your peripheral neuropathy? No matter what the cause is, this is a peripheral neuropathy severity exam to tell whether or not, number one, have you gone too far? Okay, has the neuropathy gone too far? Because here's that magic number. That magic number, remember it now, it's 85. If you have already got more than 85% of nerve damage, the chance of really helping that problem is not high, and I'll be honest with you. But if your nerve damage is less than 85%, below that mark, our chance of helping you with peripheral neuropathy pain is amazing. It's in the 80 to 90 percentile, okay? Because we have a home peripheral neuropathy program that really attacks the root cause of the problem in terms of the vascular problem. Okay, how are you going to increase blood flow? A nutritional aspect. What is causing inflammation in the body? We'll cover what is in your diet that is causing even more inflammation, that's making you worse. We'll talk about exercises and also physiotherapy, things that you can do at home to really lower your peripheral neuropathy pain and help you increase blood flow. And then also, how do we retrain the nerves to make sure that once blood flow comes back, well, your nerves comes back. It is a very comprehensive program. Our test is a very comprehensive test to try to get to the root cause of your problem, not continuing to try to cover the symptoms anymore. My goal is, number one, as a doctor, I took an oath. Number one, to do no harm, and number two, to help as many people as possible. I know peripheral neuropathy, people, and those of you who have it, which is 20 million of you out there, it has taken over your lives. And if it hasn't yet, chances are, if you allow it to get worse, it will do that at some point in time. And I urge you to really take a step forward, to really try to fix the problem, the cause of the problem, not continuously to try to mask the symptoms. Okay, if we are in your local area, or even if you are away from our local area and like a consultation, a phone, a video consultation, an in-office consultation, give us a call and schedule a consultation with me, or leave your information below and we'll contact you ourselves. All right, I hope you've learned a lot today, not only about what peripheral neuropathy is, but how it affects millions of people every single day. And I hope I've shed some light on people dealing with peripheral neuropathy, because you guys are a big percentage of the population, and most people dealing with it is 55 and up. Have a great day.